In this video about the importance of variability, myself, Paul Harper and Vince Knight will demonstrate the potential dangers of using averages. We're going to use an example from healthcare where we both tend to apply our own research. So I want you to imagine a relatively simple healthcare system such as a doctor's surgery or an outpatient clinic where patients arrive, they queue to check in at a reception desk. They then join another queue in the waiting room for some diagnostics or medical tests, and then they join another queue to have some sort of consultation with a doctor before they leave the system. And this is a scheduled system whereby every 10 minutes one patient has been booked to arrive, and we speak to the different personnel involved in the system, and the receptionist tells us that on average it takes 10 minutes to book in a patient. The nurse says on average it takes 10 minutes to do the medical tests, and the doctor says on average it takes 10 minutes to see the patient. So in this particular system we're going to make everything average based, so everyone arrives exactly every 10 minutes and everybody follows the same three-stage pathway, and everyone spends exactly 10 minutes at the reception desk having a diagnostics and having a consultation. So now I'm going to hand over to Vince, who's going to show a simulation model of the same system.
Okay, thanks, Paul. So this is a simulation model built in Simulate and put up on uSimulate. We'll put links to all the simulation models we're going to play with in this video in the description. And it's just the situation that Paul described earlier. So patients arrive, they go through three services, and they leave. And in this model, everything is deterministic. So a patient arrives exactly every 10 minutes, and it takes exactly 10 minutes to go through each one of these service centers. So if I click play, we see the patients arriving, and as we expect, no one's ever waiting. There are no queues because everyone's exactly 10 minutes after each other, just going through the system. So if we just accelerate that, see people going quicker and quicker, and if we take it right till the end, we can take a look at the results. So first of all, we see that 1,005 people got through. The minimum and maximum time in the system was exactly 30 minutes, so everyone went through in exactly 30 minutes. And what we got here is a percentage in the system that got through in less than a particular amount of time, and we set that to an hour, and that'll become relevant later on. But what we see here is that everyone got through in less than an hour.
Thanks, Vince. Now we're going to incorporate variability into the system, because after all we all experience variability when we're in that kind of healthcare setting. So the patient doesn't always spend exactly 10 minutes seeing the doctor, for example. So we go back to the three people, the receptionist, the nurse and the doctor, and say, well, on average it takes 10 minutes, but can you give us any more information? So they say, well, maybe 5% of my patients have finished within 5 minutes of their service time. Maybe 5% of patients are still having a service after 15 minutes, and the 90% is somewhere in between. So in the absence of any other accurate data, we could assume some sort of symmetrical distribution for time, such as this one shown here as a normal distribution, where we have the 5% in the left and right hand tail, and the 90% somewhere in between, around the average of 10 minutes. And so if we were actually to collect or observe service time data and plot that, it would look a bit like this. And so now we're going to go back to our system, exactly the same one as before with the three consecutive services, but rather than use an average of 10 minutes, we're going to plug in the distributions, the normal distribution for the service times for all 3 points. But the key thing is we still have an average of 10 minutes, but now we have variability. So in the next model Vince is going to show, it'll be the same model, but this time incorporating the stochastic features with the variability in service times.
Okay, so what we're looking at here is basically the exact same model as before, except that we have that variability in the service times in these three centers. So if we run the simulation, the first thing we start seeing is a buildup of queues. We didn't have a queue in the previous model, but here we start seeing people actually waiting. So if I get that going a bit faster, we see the queues building up a bit more, and if I run it straight till the end and look at the results, we see that first of all less people got through the system, Some people got through in just under 30 minutes. One person got through in 240 minutes. But the average time in the system for something that, if we assume there was no variability, should just take half an hour, is now taking 2 hours. And if we look at the percentage of people that got through within an hour, there's only 7% of people got through within an hour. So something that was taking half an hour, now most people are taking more than an hour to get through. And that just shows the danger of planning services just incorporating the average measures. There's a lot more variation that can occur. Obviously, for example, what often happens in healthcare services is there's lots of variability in the time between arrivals. For a GP surgery, for example, people might be 5 minutes late for their appointment, or might even miss their appointments. So there's a lot more variability that can occur, but hopefully this video shows the basic impact, and even with the small amount of assumptions we've made here, the danger of assuming no variability in a system.